Hi there. I am making this video today because I have been contacted by a lot of people asking me about information about Covid-19 and about what they can do in terms of boosting their immune system and helping them be as strong as possible in case of any infection. My name is Daniela Turley. I'm a medical herbalist. You can hear from my accent I'm British. I'm UK trained. I've been practicing for 20 years. From an American point of view, it's very similar to a naturopathic doctor. The training is almost identical, in fact. I work in a functional medicine practice along with other healthcare providers, including a medical doctor, Miriam Rahav, nurse practitioner, and also different modalities of healing. So I want to first of all talk a little bit about what the coronavirus is. I'm sure you guys probably know a lot of this, so I'm going to kind of go quickly. So it is a novel virus, and what that means is we haven't had this virus in the human species before, this particular virus, and it means that we don't have antibodies against this virus, which means that when people do get the illness, they're more likely to come down with symptoms because they don't have like this antibody circulating to start an immune response quickly. So that's the situation we're in. It is an RNA virus, which means that it has RNA as its genetic material instead of DNA, and it contains this capsule, and also probably from the pictures everyone's seen it, these kind of glycoproteins that form spikes around the outside of the capsule, which is what gives the virus its name, the coronavirus. So I wanted to talk just a little bit first about some new information we're finding out that's literally been out in the last week actually. So I think it was in Nature, or was it in Cell? I think it was Nature. They were discovering that this SARS virus enters a cell, the ACE2 receptor, which is actually the same as the SARS virus, previous SARS coronavirus as well. So that's the angiotensin converting enzyme 2 receptor. And I just mentioned that because a couple of drugs and herbs possibly might influence that. So the first is the chloroquine, also known as Plaquenil, which is an anti-malarial medicine, and that seems to downregulate these receptors, and that is possibly why it's having a positive effect. And this has been used in China during the outbreak they've just had there. And then the other one is actually psychosaponins, specifically the beta-2 psychosaponins in bupleurum, and this may also influence the virus's binding and getting into the cell. Some of you may have also read about plant lectins, so some specific specific plant lectins may also work in the same way, but we're not going to go too much into that now.
So I just wanted to add here that they are also now saying that certain ACE inhibitor drugs, like blood pressure lowering medication, is actually having a negative effect because it is essentially increasing these ACE2 receptors on cells. So if you are taking medication for blood pressure that's an ACE inhibitor, you may want to discuss with your doctor about switching to a different kind of medication.
So moving forward, so what would you expect to get? What are the symptoms you'd expect to get with coronavirus? So coronavirus, or this specific coronavirus, Covid-19, seems to give people a flu-like symptom. So a fever, a headache, a cough, a dry cough, some stuffiness, but rhinitis, which is a runny nose, isn't a major component of this illness. Some people may get digestive complaints. That seems to be in the younger cohorts, and vomiting, diarrhea, that kind of thing. Some people get pneumonia. We've all read about this. So a complication would be a viral pneumonia that in some people, a small percentage of people, can be fatal. So there seems to be, however, a wide variation in the severity of this illness. So people may have no symptoms at all, or they may have mild symptoms, or they may have moderate symptoms, so like a flu and they get better, and then they may have the severe symptoms when they are hospitalized and will need oxygen and quite aggressive kind of treatment to keep alive. They're essentially having to be on respirators. So there is a wide variety of severity of this disease. There does seem to be a difference in terms of what group you fall into in terms of how likely you are to have a severe form of this disease. So if you are in a sort of at-risk group, it tends to be the elderly, and also if you have certain diseases, so for example diabetes, heart disease, respiratory disease including asthma, and cancer. So if you're either elderly or you have one of these what we call comorbid conditions, that does put you in a high risk category for having complications with this illness. If you are, on the other hand, young, so especially the very young, sort of under the age of 10, they seem to go through this in a breeze, and kind of your risk does increase incrementally with age. But the vast majority of people will probably have this disease in a form that's, you know, mild to moderate, and then the minority of people will have complications, and at the worst case, you know, this may be the last disease they have before they pass, which obviously is really sad. So a lot of people want to know how they can help their immune system to give themselves the best chance against this illness. So today in this talk I want to talk about a few different things. So one is traditional Chinese medicine. So I think this is major because in China they've treated probably the most people in the world with herbal medicine thus far. Number one, they had a huge outbreak, and number two, they use traditional Chinese medicine as part of their hospital system, and they have used it in this particular epidemic. So we have some good information coming out of China in terms of what herbs they're using at which stage in the condition. The second bit of information I'm going to talk about is Western herbal medicine. So the things that most medical herbalists, naturopaths, even functional medicine doctors are going to be aware of, what kind of immune boosting herbs and potential antiviral herbs. Obviously we haven't had the experience yet of treating coronavirus widely. I'm hearing some information coming out of Italy, so I will definitely share that with you. But you know, we don't really have that much experience as Western herbalists, so it's kind of theoretical at this point. And then the last thing is going to be nutrition. So what kind of like dietary supplements could help you have a better chance against this virus? Because the whole idea of anything I'm saying today is to encourage people to have, instead of an extreme illness, I'm trying to get people to have a mild illness. And that's why I'm kind of sharing this information, because I really do believe that certain things we do may help us have that kind of mild illness. And I see that with, say for example, seasonal flu, that, you know, patients of mine will say, you know, if I'm doing X, Y, and Z, taking my herbs, taking my supplements, I don't get sick. Everyone around me's got the flu, I didn't get it. So we already know that certain immune boosting things, and that's not just from anecdotal evidence, we have quite a lot of good research on these things. Everything I'm saying, more or less, I'm going to be putting references up. So when you see the slides, you'll see references. Towards the end of the talk, I started running out of time, so I might not have put all the references in, but I'm very diligent about information I share, just generally. Of course, a lot of herbs, it is traditional use, and they haven't got the research, but there is a lot of stuff that is being researched now. So I think, you know, let's use this ancient medicine and help us have the best immune system possible. So the first thing I wanted to mention before I dive into that is just some basic prevention. If you have, or if yourself are in the at-risk category, if you're elderly, if you have a concurrent disease that we know is an at-risk disease, high blood pressure, diabetes, etc., you know, you have to be extra careful. Some people in those groups are already self-isolating. If you have a family member or a friend, you yourself are not in that group, but you have a family member or a friend in that group, you may want to think about your interactions with them. Do you want to get on a subway, go into a restaurant, and then go and visit this elderly relative? Is that the kindest thing you can do for them right now? So I think it's probably wise for some social distancing in that at-risk group, because they are the most vulnerable in our community. You may also want to reach out to people in this at-risk group and offer shopping advice in terms of, you know, what we're discussing right now. You may want to ask them if they need any help in terms of things they may need you to get for them. So I think that it's good for us at this point. We're going through potentially an epidemic, or we are in the start of an epidemic potentially. We are officially in a pandemic right now, right? So we want to kind of like pull together and help each other, because some people are going to have no problem, and then other people are going to have severe problems. So we want to help those people in our community who are going to have the problems. So I want to move on now to the first bit about herbal medicine and COVID-19, and I'm going to focus initially on traditional Chinese medicine and COVID-19. So in China, where the virus is or has been very widespread, it's obviously slowing down there now, but they have widely used herbal medicine in the treatment of COVID-19. They have also come up with a formula that is a preventative formula. So traditional Chinese medicine, TCM, is an ancient modality and has been used for millennia. And so a lot of these formulas and ideas are not something that they've just come up with, that they're based on ancient traditional remedies. But there is evidence, we have clinical evidence of the benefit of these remedies also. So the first thing I wanted to mention was preventative formula. So I'm going to share that formula with you, and so you guys can refer to it and as I'm talking about it. So this formula has been used in China in the prevention of COVID-19, and to quote a study that came out just this February, it said, based on historical records and human evidence of SARS and H1N1 influenza prevention, Chinese herbal formulas can be an alternative approach for the prevention of COVID-19 in a high-risk population. So this is where this remedy would fall into. So this remedy is a prevention for influenza and pneumonia. And as you will see, it contains a fairly well-known herb, astragalus. This is a herb that boosts immunity and it modulates inflammation. I'm going to be talking about it more later on, and for those of you who've been following advice I've been giving in the last few weeks, you have heard that I've mentioned this herb as a potential herb that people could start taking straight away. It also contains a herb called Fang Feng. The Latin name is Ledeburilia. So this is a herb that is used regularly in China to prevent infection. So they say it disperses wind and cold. So from a Western point of view, it would almost be like fighting off a viral infection, for example. Another herb that is a very interesting herb to mention is Japanese honeysuckle. So this is one of the herbs that is in a famous formula called Shuang Huang Liang, which I probably pronounced completely wrong. This formula has been shown to stabilize mast cells and attenuate airway hyperresponsivity. So what that means is it's helping to control the inflammation in the lungs. So what you've got here is a preventative formula that is controlling at the same time inflammation. What we know about infections, or especially this infection, is that your body has an immune response to it, which is neutrophil based. When you haven't got antibodies, you're going to have a lot of neutrophil infiltration, and then you get a lot of kind of debris formed, cell debris from the kind of body's response, the attack, but also just the virus bursting out of cells. So what that does is it causes inflammation, and we have cells and mechanisms in the body to clear that away. So things like macrophages go and they're like sweeping up all the rubbish, right? So what can happen though in these situations is that the amount of debris is too much for the body to cope with. And then it's quite possible that certain people are more in an inflammatory state than others. We do know that chronic inflammation, that's fairly well accepted now in the medical community, whether it be diabetes, heart disease, all these diseases we're already talking about have a component of inflammation there, right? So it's interesting that this preventative formula is already kind of looking at that, it's already kind of attenuating the inflammatory response. It's putting the body in a more anti-inflammatory state even before you get infected. And I think from what we know of just general other infections and other kind of inflammatory reactions in the body, this seems like a smart idea, and it's possibly why this herbal formula has been made up. The other thing is, I just briefly bring in energetics. So this disease is seen as being like what in Chinese medicine they call like a damp condition. So people who have it are showing signs of a thick coating on their tongue quite often, maybe a swollen tongue, which in Chinese medicine is like a damp sign, of a damp condition. And actually, energetically, this formula is also derived for that. So there is the kind of medical, the biochemical side, which we're talking about in terms of inflammatory mediators and antivirals, but there's also the energetic side of it. And if this is a damp condition, you're going to want herbs that are going to boost up your, for example, spleen meridian. So this contains atractyloides and astragalus, which are herbs that help to boost that up. So that is kind of the main preventative formula, and the formula that I personally am taking is a variation of this. I have changed it somewhat, and I'll come to that at the end. I'll say exactly what I'm taking, but I am trusting what they're doing in China, because they're the ones who are the experts, and I think we're kind of would be foolish to ignore people who've had the most experience, current experience of treating this disease with herbs, right? So moving on, so the next stage we're going to be talking about is really when the disease is going more into the flu stage. So what they've done in China is it's not just one formula. So you're not just like, okay, now you're sick, now you're going to switch the formula into a different formula. They've got several different formulas. So this is where it does become quite complicated, especially for a Western mindset. But I do want to share them, and if you want to skip past all of this and get to the Western herbs, go for it. But I think this is really important information for people. So first thing is, you would stop the preventative formula, and some people are like, why? But actually astragalus is contraindicated in an acute infection, so you wouldn't want to take it if you are acutely sick. It is a preventative formula. So once you get sick, you may have a sore throat, you may be having the onset of fever, you may be having some chills, some headache. This is the kind of stage 1 flu formula, kind of the onset of the flu. So I'm just going to go through this formula, and what you will see is that it also contains Japanese honeysuckle, which is one of the herbs that is in many of the formulas. It also contains fresh ginger and licorice, which I'll be talking more about later. One herb that is in there that you won't be able to get in America is ephedra. Ephedra is a great herb, but it is restricted in America. However, you can get that in the UK through a trained herbalist as part of a formula. So this is essentially, like I said, a formula for when you're having, in terms of energetics, it's wind cold invading the exterior. So this is when you're having the very first signs. So you're having a low-grade fever. You're having an aversion to the cold. You're not really showing overt heat signs, and you may be having a headache. So after that, we are going to move on. So now we're moving on to stage 2 flu formulas. So in the Chinese experience, they treated people differently at different stages of the flu. So at stage 2 is when you are having in a CT scan some opacity in the lungs. In other words, it's starting to go into a pneumonia really. And they fall into 2 main categories. There's one that's for a flu where there's heat, and there's one for when it's cold. So I'm just going to briefly go through both these formulas. So basically in the first formula, you're going to be having it if there's a fever, there's going to be maybe still aversion to the cold. With your tongue, the main difference you're going to see is you're going to have like the red sides to the tongue we were talking about earlier, red tip. You may have a yellow coating, you may not, but the red sides would be there. And the treatment strategy is similar to before, but we're trying to cool the body now, we're trying to clear heat. So this formula still contains Japanese honeysuckle, but now it also contains the cooling coptis. which is a potent antibacterial herb, and it has powerful alkaloids, including berberine, that reduce inflammation. They're antimicrobial and they also clear heat. It also contains the famous Chinese herb lianjiao, which is forsythia fruits. So that, together with the honeysuckle, acts on reducing inflammation in the lungs. We mentioned earlier, I think you'll probably remember, the famous Chinese formula, Chinese formula, shuang kuang, that prevents inflammation in the lungs. So this is going to be, reducing the bronchial hyperresponsivity. It's going to be reducing the mast cells. There's chemicals here that are going to be reducing the cytokines, so cyclooxygenase, lipooxygenase, the interleukins. So all these inflammatory mediators we know are involved in the development of pneumonia. So this is great to kind of nip it in the bud, essentially. The second formula I want to talk about is basically almost exactly the same phase, but the difference is you're going to see on the tongue mainly. So you're going to see in this situation the tongue's going to be pale, and you're going to see a coating, probably fairly thick coating. And then also in this kind of cold situation, cold flu energetically, you'll see more digestive problems. So you might get bloating or diarrhea. And the formula here is more set up for supporting, in a way, the digestion and the spleen meridian. So it has fresh ginger, which I mentioned earlier, and we will be discussing again later in more detail. It contains the spleen tonic atractyloides, which is a very widely used Chinese herb, and it uses citrus peel, chen pi. So this is, from what I'm hearing, is the more rare pattern. So most people are having the heat pattern rather than the cold pattern. But that's not to say you're not going to see patients, if I'm speaking to herbalists now, or yourself may fall into this category. It becomes a little bit tricky because you have to have either multiple formulas on hand, or what I'm actually doing with some of my patients is giving them one formula with two separate herbs. They can either add depending on whether it's like a cool situation or a hot situation. So the next phase of treatment and the herbal formula I want to share with you is the pneumonia phase, and that does seem like a scary phase to talk about, because obviously this is the stage in which some people can become seriously ill. Now, I'm not suggesting that those with severe pneumonia, breathlessness, cyanosis, which means their lips are going blue, should be, you know what, I'm going to take my herbs. No, you should go to hospital. The best treatment is going to be intubation, it's going to be oxygen, and all the kind of medications they can give you to actually act as an antiviral in your system. So what I'm talking about here is for people who, if there was a widespread epidemic, there's going to be a wide variety of people who are sick with pneumonia. There's going to be people that are very sick, and there's going to be the people who are mildly ill. There will be people probably who are going to be treated in the community with mild pneumonia. So this is the information for you guys. So I'm going to share that formula. It is a recipe for Xiao-Yang syndrome, and so the symptoms include fever, which is more pronounced in the afternoon, alternating chills with fever. You will have a cough, of course, at this point, sometimes a bitter taste in your mouth, a dry mouth. And really, this is, like I said, the start of pneumonia. So this herbal formula contains buplorum, and you may remember from earlier that I said that this is possibly a herb that stops the cell invasion of the virus. So this may actually have some antiviral effect, but it also has other effects in the system also. It also contains Baikal skullcap. So Baikal skullcap, I think, is going to be a really useful herb at the later stages of this condition. It contains potent anti-inflammatory chemicals, Baikalin, also quercetin. There's some interesting research coming out of Canada for the use of quercetin and the SARS coronavirus. So again, it contains that chemical, that plant chemical, and this potentially also can calm the inflammation of the lungs. So as well as possibly being antiviral, it's also going to be calming the inflammation of the lungs. it contains bitter apricot seed. So this is similar to the Western herb cherry bark, which contains compounds that actually are going to somewhat suppress the cough, so you're not constantly coughing and like tiring yourself out. So that is the kind of roundup of the Chinese approach to treating the COVID-19 virus. So now I want to talk to you about the potential Western approach to prevention and treatment of viral infections such as COVID-19. Obviously, in Western herbal medicine, we haven't had much experience of treating this virus infection. There is some anecdotal evidence of it being used in Italy and certain cases in New York, but this is just through word of mouth or people who have reached out to me and spoken to me. So most of this is going to be theoretical. It's not like in the Chinese experience where they've treated thousands of people and they're like, this is the formulas. This is us, in a way, it's theoretical, but I don't think it should be discounted, and I'm sure as the months go on we're going to have lots more stories coming out of people who have been doing a great job of boosting their immune system with the Western herbs. So the first one is going to be a surprise and somewhat for you guys, because I'm basically be talking about astragalus again. And the reason I included this in this section is because astragalus is actually in 99% of Western herbal medicine dispensaries. In my dispensary, I have a lot of Chinese herbs though. So I wanted to go a bit more into it. So as I've already mentioned, it has been used in the preventative stage of treating COVID-19 in China. It does contain polysaccharides and triterpenoid saponins, flavonoids, that are the main active ingredients that have this immunomodulatory effect. It actually suppresses something called necrosis factor kappa beta. And for those of you who are kind of like health geeks and learn about these things, this inflammatory mediator is involved in like a cascade inflammatory reaction that if you block that mediator, what you're doing is attenuating runaway inflammation. So that's one of the reasons we use this herb a lot in autoimmune disease actually. So I think it's again another reason why it's a great preventative herb, because it's going to put you in an anti-inflammatory state before you get this disease that's potentially going to create a lot of inflammation. So I do think that this would be one of the main herbs I would recommend. If people can only just take one herb, I would definitely recommend astragalus, because A, it's been used in China and they know what they're doing with this essentially, but B, it may be helping more those at-risk groups because of this anti-inflammatory effect. So moving on, the second herb I wanted to mention, which I know a lot of people out there are taking already, is elderberry. So elderberry has a long history of use for viral infections, and for that reason, that's one of the reasons I'm recommending it in the prevention phase. The flower, so elderflower, which is the flower from the same plant, is used more in a fever state, so when you have the flu symptoms, so later on in the viral infection. But at the beginning, you might want to use elderberry. Elderberry has been used widely and has been shown to reduce the severity of influenza and the common cold. So we're kind of making a leap that it's probably going to have a similar effect against the coronavirus. We do not know that, but we're making kind of an educated guess that it will have a similar effect. So elderberries contain polyphenols, and it has been suggested that the polyphenol content may be part of its medicinal action. We don't know this for sure. Polyphenols are found in berries, and there is an argument that eating any berries during this time of viral infection, so in the winter, eating any berries is probably a good idea for your immune system. The thing that is like the question mark for elderberry people are talking about is it can increase certain inflammatory mediators, and so therefore what I have been advising, just because this disease does seem to involve a lot of inflammation of the lungs, is that if you are going to take elderberry as a preventative medicine, you don't just take it on its own. Maybe you take it with astragalus. And again, as with astragalus, you stop it at the acute onset of the infection, and you switch then to something else. So in this case, it may be the elder flower, right, instead of the elderberry. So I wouldn't necessarily say you have to not take it as a preventative, but possibly think about stopping it at the advent of any symptoms. So moving on to the next herb I want to talk about in terms of preventative is good old echinacea. So echinacea is a North American. So the next herb I wanted to talk about was good old echinacea. So most of you will have heard of the name of this herb, which is a Native American herb, and is a great herb against, colds and flus and avoiding getting sick in the winter. Many of you, I'm sure, have had some experience of taking this herb, and it has a really positive effect on your immune system. So one thing that they have found in the Covid-19 cases is that when people come in, their white blood cells are decimated. So their white blood cell count has really been diminished by this infection. The nice thing about echinacea is it's boosting up your innate immunity. So your non-specific immunity is being improved by this herb. And so that means that you're going to kind of go into any infection you may get with like a good amount of white blood cells to fight this infection off. The other nice thing about this herb is that it is antiviral. So the whole of the plant is antiviral. And although we don't know if it's specifically antiviral against this particular viral infection, because it's antiviral against many other viral infections, it's not a bad thing to take and ward off other viral infections, so your immune system is as strong as possible for this particular strain. However, it may be effective against the coronavirus. We don't know. The other thing that's nice about echinacea is it actually helps with reducing inflammation. So it's not just purely an immune stimulant, it's an immune modulator. So some of those chemicals we talked about earlier, so interleukin-6, tumor necrosis factor alpha, these are kind of like inflammatory cytokines that we know are involved in inflammation in the lungs when you have these kind of pneumonias. Echinacea is attenuating these, it's kind of reducing them. So again, it's like a great herb, I think, to prepare for a virus like this. So that's another one that I think is a great preventative herb. Another group, which is not technically a herb, it's actually a fungus, of course, is medicinal mushrooms. So medicinal mushrooms are great, and if you've never had experience taking medicinal mushrooms, it's a great place to start with in terms of trying herbal medicine out, because they're very food-like, and most people feel really pretty good on them. So there's a wide variety of medicinal mushrooms. They include maitake, shiitake, turkey tail, the list goes on. There's so many types, and they all have these kind of polysaccharides, which are like sugar-like compounds that have an immune stimulating effect. Mostly immune stimulating. There are some also immune modulating mushrooms, but I'm just talking about them as a group right now. So they contain these chemicals called beta-1,6 and 1,3 glucans. And one that I like particularly for immune boosting is actually shiitake mushroom. I like this because you can actually eat it as a food. So shiitake mushroom also contains lentinin, which is an immune boosting chemical. So I think that would be a really accessible way for people to incorporate a medicinal mushroom into their routine by eating them, and eating the mushroom regularly to sort of support the immune system. So moving on, the last preventative herb, there are many others, but I'm just going into a few to keep a time limit on the talk. So the last one I was going to talk about is usnea. So usnea is actually, again, not technically a herb, it's a lichen. So it is also known as old man's beard. And it has a really long history of being used as preventative medicine against viral and bacterial infections. So usnea contains a couple of things. It contains, just like with the medicinal mushrooms, it contains beta-glucans, alpha and beta-glucans that are immune boosting, as we mentioned earlier. It also contains usnic acid that does have antiviral properties. We have not, again, tested this against COVID-19, but it has been shown to be effective against influenza. It also has this kind of soothing effect to the mucous membrane, so it contains anti-inflammatory mucilage components, which basically have a soothing effect to the whole respiratory tract. So it's also, as well as being immune boosting, antiviral, it's also anti-inflammatory, which, as we've been discussing, are kind of three main things we want to have against this specific virus. So next I wanted to move on to, once you're sick already. Next I want to talk about flu symptoms and Western herbs and ideas of what you guys could take during that kind of flu stage of any COVID-19 infection that you may acquire over the next few weeks. Also, this could be taken during seasonal flu or a flu-like cold as well. So these are all good information for you guys to have. So with herbal medicine, we don't give one herb. We don't give like echinacea. People like to sort of say, what one herb would you say to take for X, Y, and Z? We use formulas, and the reason we use formulas is because there's a balance to that formula, and also because herbs have different different actions, right? So you may have a herb that's mainly a diaphoretic. So diaphoretic means a herb helps you to sweat and then cool down when you have something like an influenza. And then you may have another herb that's actually much, much better at expectoration, and it's much more antimicrobial. So you take them both together, of course. So most herbal formulas, I should say, have 4 or 5 herbs in them. And additionally to that, you may even take a tea on top of that. So when I'm going through these herbs, I've kind of separated them out into different categories, like expectorant, immune boosting, lymphatic. And what I would suggest, because obviously you're not going to go and probably be, well, maybe you are, you go and buy all of these herbs individually and formulate them yourselves. Great, you can do that, wonderful. But you may want to just take this list into a health food shop and see if you can see a formula that has multiple actions. So you're not just having a formula that's antimicrobial or expectorant, but you've got different actions. And as herbalists, we ourselves will go into shops and look at formulas. I did this the other day with a friend of mine who was sick, and I was like looking at all the different formulas, and I was like, that's the one you need. Now, how's she going to know this? So it's tricky. So that's why I think it's quite good to have a guide like this. Obviously, you can contact your local herbalist, and I'm sure they'll be happy to work with you to make like a balanced formula. I will just mention a formula at the end. If you guys, do manage to get the individual herbs, you can make yourselves. It's a general flu formula. So first, I'm going to put the list on the screen. So the first herb category is diaphoretic. So I mentioned that just a second ago. So diaphoretic herb is a herb that induces sweating, and it's essentially going to reduce your fever. And sweating is seen as also a channel of elimination, because actually your sweat glands are like mini nephrons, and a lot of what comes out of sweat is actually very similar to what's in your urine. So you actually are excreting through sweating as well. So it's good for detoxification, and it's good for cooling the body. So elderflower is a really great herb. So we mentioned elderberry earlier as a kind of like immune boosting preventative herb for the flu or any viral infection, COVID-19. Elderflower is going to reduce your fever. It's also really anti-inflammatory. It's packed full of anti-inflammatory compounds. And as we were discussing with this disease, we want to calm the inflammation in the lungs so it doesn't kind of get out of control. So I think elderflower would be a great addition to a flu mix. I've put catnip in here. It's mostly for kids. Obviously adults can take it. It's great for fever. I gave it a lot to my child when he was little. Tilia. So this is a flower from a tree, from the tilia tree, Tilia cordata. And the nice thing about tilia is it will bring on, the sweating and reduce the fever, but it's also very relaxing. And what we're seeing with the virus is that kind of part of the illness is the fact everybody's very anxious. Obviously, it's not to do with the actual virus itself, but people are really stressed right now about this. So I think that would be a really nice herb to put in the flu formula, because maybe as you're getting sicker, you're getting more scared. So it's going to help as a diaphoretic, but it's also going to help to relax you. It's a great herb for anxiety. Pleurisy root is a great herb, especially if you have like your lungs are hurting when you're breathing, and the pleura is inflamed. So pleurisy root is a great herb for that reason. Lobelia is also an expectorant and opens the bronchioles. Lobelia is a little bit tricky with dosing, because the higher dosing can cause some side effects. So you may want to do that under supervision of a herbalist or in a pre-formulated formula where the dose is calculated for you. Thyme. So thyme is going to come up again and again because thyme has many different actions. So thyme, as well as being a mild diaphoretic, it's also antimicrobial, it's an expectorant, and it's really easy to get hold of. So you can go to your local grocery store and get some fresh thyme. And what I would suggest is, putting some in a cup. I've got my cup here, I'm having my tea, and then you can just put a plate on top of it to trap the essential oil, because the thymol is very antimicrobial. Leave that for 10 minutes to brew, and then you've got your thyme tea. And you could actually put other herbs in there, some ginger, you could put, food-like herbs I'm talking now, incorporate that into that tea, which would be really good for your lungs. Yarrow, this is one of the herbalist's favourite herbs, I would say, for fever and flu. It's also really good because it's a bitter, stomatic herb, so it's really good for when you're having any kind of bloating or digestive upsets that some people are getting with this coronavirus. It's been reported, so that would be a great herb for that, and it's going to help you with the fever and the sweating. Ephedra, I'm going to just go over briefly, because that's kind of a Schedule 3 herb, so you'll only be able to get it from a qualified herbalist, and in fact in the US you can't get it at all, but it would be a great herb if you have been prescribed it by your herbalist. Capsicum, which is chili, again, it's something you can get in a store very easily. It's something you can get in like fire cider, which is a great tonic to take when there's viruses around. And it does, obviously, as we all know, we eat enough chili, it will induce sweating. It wouldn't necessarily be the first herb I would go to, because it is very heating, and as we said before, some people are going to be presenting with a lot of heat in this situation, so you may want to go more for elderflower in that situation. Osha is another great herb, almost a bit like thyme in the fact that it's also antimicrobial, it's expectorant, and it's a diaphoretic, so it has these multiple actions. Peppermint, again, a great easy herb to get. It's in the Chinese formulas, as you may have remembered from earlier. You can get it in any supermarket and health food shop, and it works. You need to make it strong enough, so I would recommend making 2 tea bags in a cup, and again do the whole same method I was telling you about. Cover it up, leave it to brew for like 10 minutes, and that would be a great thing to take if you haven't really got access to any herbal formulas. Bone set. So bone set is easy to remember what it's good for, because it's like when you're getting to that aching phase, your bones are aching, and the reason your bones are aching is your bone marrow is trying to produce more white blood cells, right, to fight this infection. So bone set has this ability to stimulate the bone marrow to support your immune system, and it also is going to help with the influenza symptoms, which obviously in this case it's Covid-19 symptoms, where you're going to it'll induce sweating, which will cool you down. The only thing to mention with it is it can cause some looseness of the bowels, which isn't necessarily a bad thing, and actually in some of the reports, some people are getting constipated with this, so that would be a great herb if you are a bit constipated. And some of the Chinese formulas that I didn't include in my slides contain rhubarb for that reason, to kind of help the bowels to move. So something to think about, you can get your hands on it. So moving on to, so that's a diaphoretic group. So you really want a formula that's got at least one diaphoretic in it, okay? At least one. Then you've got yarrow. This is one of the herbalist's favourite herbs, I would say, for fever and flu. It's also really good because it's a bitter stomatic herb, so it's really good for when you're having any kind of bloating or digestive upsets that some people are getting with this coronavirus. It's been reported, so that would be a great herb for that, and it's going to help you with the fever and the sweating. Ephedra, I'm going to just go over briefly because that's kind of a Schedule 3 herb, so you'll only be able to get it from a qualified herbalist, and in fact in the US you can't get it at all, but it would be a great herb if you have been prescribed it by your herbalist. Capsicum, which is chili, again it's something you can get in a store very easily. It's something you can get in like fire cider, which is a great tonic to take when there's viruses around. And it does, obviously, as we all know, we eat enough chili, it will induce sweating. It wouldn't necessarily be the first herb I would go to because it is very heating, and you know, as we said before, some people are going to be presenting with a lot of heat in this situation, so you may want to go more for elderflower in that situation. Osha is another great herb, almost a bit like thyme in the fact that it's also antimicrobial, it's expectorant, and it's a diaphoretic, so it has these multiple actions. Peppermint, again, a great easy herb to get. It's in the Chinese formulas, as you may have remembered from earlier. You can get it in any supermarket and health food shop, and it works. You need to make it strong enough, so I would recommend making 2 tea bags in a cup, and again do the whole same method I was telling you about. Cover it up, leave it to brew for like 10 minutes, and that would be a great thing to take if you haven't really got access to any herbal formulas. Bone set. So bone set is easy to remember what it's good for, because it's like when you're getting to that aching phase, your bones are aching, and the reason your bones are aching is your bone marrow is trying to produce more white blood cells, right, to fight this infection. So bone set has this ability to stimulate the bone marrow to support your immune system, and it also is going to help with the influenza symptoms, which obviously in this case it's Covid-19 symptoms, where you're going to it'll induce sweating, which will cool you down. The only thing to mention with it is it can cause some looseness of the bowels, which isn't necessarily a bad thing, and actually in some of the reports some people are getting constipated with this, so that would be a great herb if you are a bit constipated. And some of the Chinese formulas I didn't include in my slides contain rhubarb for that reason, to kind of help the bowels to move. So something to think about if you can get your hands on it. So moving on to, so that's a diaphoretic group. So you really want a formula that's got at least one diaphoretic in it, okay? At least one. Then you've got the immune boosting components. So we've mentioned some of these already. So echinacea we've covered, so we'll scooch on from that one. Garlic. Garlic is, again, something you can get without any bother. Fresh garlic is the best because it's going to have the highest allicin content. So you want to crush it, wait for 15 minutes. The enzyme reaction that makes the allicin will then occur. And then you really want minimal heat. So I know a lot of people aren't keen on eating raw garlic, but I think it would be a really great idea during this kind of time because it really is antimicrobial. Again, the fire cider we mentioned earlier. I mean, fire cider has got a lot of these things in, so you may even want to get a bottle of fire cider and take a spoon of that preventatively. Biscuit root. So biscuit root is a Native American, traditional American herb, and again, I've been seeing that's been going out of stock. So if you can get hold of that, I would definitely recommend that because it's also going to help because it's going to expectorate. So as well as it being an immune boosting herb, it's going to have an expectorant effect. Also Oregon grapefruit. Oregon grapefruit is Mahonia, and so we talked before about in the Chinese formulas they had coptis, so they're kind of related plants and they both have this kind of bitter cooling effect, and they both do contain berberines, which is an alkaloid that is antimicrobial. So that is a very cooling herb. So again, if you're like energetically cold, that may not be the best herb for you, but it is a great antimicrobial herb, and it kind of is good for the mucous membranes too. It's a mucous membrane tonic. We've mentioned Osha already. Thuya is antiviral, and that is definitely a herb that is in most, in many flu formulas, but it's something you may see when you're looking for formulas in shops. It's also a homeopathic remedy as well. So we've mentioned already quite a lot of expectorant herbs. So an expectorant herb is a herb that you are hoping to liquefy the mucus and you're hoping to bring the secretions up. There are herbs that do the opposite of that, they kind of stop the secretions, but I'm not kind of talking about those right now. I'm talking about really when you're in an acute infection, you want any secretions being produced to kind of come up. It does seem that with COVID-19, it does seem to be a dry cough, right? So I don't think you're going to get a lot of mucus being formed. So actually, I think that I would be more leaning towards adding some, what we call in herbal medicine, we call demulcent expectorants, so kind of more soothing to kind of calm that cough. So that would be things like the marshmallow or the usnea, or even to a degree the marubian would be maybe a good one there. So apart from those, you've also got the inula, which is Inula helenium. It's not only an expectorant, but it's very antimicrobial. And it also contains something called inulin that feeds your beneficial bacteria. So it boosts your immune system by supporting your microbiome. It's actually a great herb. So I would definitely recommend inula as a great addition to any flu stage or active stage COVID-19 remedy. Many of those herbs I think we've already covered. The only one I think we haven't covered viola. So viola is violet. Viola can mean pansy because there's different species within the kind of the genus there. So right now you've got sweet violets are actually in flower. So again, if you live in the countryside, you may want to pick those and make violet syrup. You can use the roots are more expectorant, and it's kind of a forgotten herbal medicine. A lot of modern herbalists don't use it that much, but it's great and it works. But it requires a bit of work, and if you're going to especially use the roots, you have to really ethically harvest it. But sometimes it is in commercially available remedies. I have seen it in remedies. And so moving on to what I've kind of grouped them together actually, alterative herbs and lymphatic herbs. So some of these herbs do both, some do more one than the other. So this is seen as like a blood and lymph cleanser. So obviously when you're ill, the lymphatic system is a passive system, but it is basically transporting white blood cells around your body, and you have your lymph nodes where you're having maturation of white blood cells, and these herbs are seen as being like to help move that whole system around, but it's probably a bit more complex than that, how they're actually working in all honesty, but that's kind of like the traditional approach to them. And because you need to take often quite a lot of alterative or lymphatic herbs, it is kind of nice to, I think, have these on the side as a tea. Some of them may already be in your formula. So echinacea, think of as being an alterative or lymphatic herb. It doesn't spring to mind for many people, but it is. So that is obviously also an immune booster. We've already mentioned that. So that could be in your formula. But you may want to do something like burdock or even red clover as a tea, because you can take a lot more of it, or even calendula, that's marigold. So taking some kind of lymphatic herb, nettle tea would be very nice because it's also anti-inflammatory. It contains quercetin. So maybe choosing one of those alterative lymphatic herbs as a tea would be a really nice thing to support you through any illness. So what I just jotted down a quick influenza remedy based on Western herbs. This isn't actually what I'm going to be doing for, I don't really like doing generic formulas, and most of my formulas are going to be for my patients. But if there is situations where I have to, like a patient may say, please can you send something to my mother, or please can you send something to my brother, or a member of the public sometimes may contact me, I'll have to speak to them on the phone. So I don't really like, I'm not a big fan of just making things up randomly. But I'm going to give you a formula. So I was just thinking that a good one could be a combination of yarrow, elderflower, echinacea, inula, licorice and thyme. So that could be a nice formula that has a good kind of blend of herbs that would help if you had a flu. And like I said, you might want to, on top of that, do a tea. Like I said, in my formula, it's probably, I'm going to contain some of the Chinese herbs, in all honesty. Honeysuckle, for example, for sure. Honeysuckle, for example, for sure. And forsythia. So I think, but that is, it would still probably work, I think, either way. But I just am very happy that they've had a lot of experience in China, so I'm kind of following their lead in a way in treating this. So I just wanted to talk now, we've talked about most of the herbs, I think. I wanted to talk about supplements, dietary supplements, so vitamins, minerals, that kind of thing, and also the actual diet. I think that's a really important part of keeping your immune system as strong as possible. So with the supplements that I have been taking myself and suggesting for other people, these are the ones I would recommend. So vitamin D has been shown that if people are low in vitamin D, it has a negative impact on the immune system, and you are much more likely to get the flu. There's been plenty of clinical trials that back this up. So making sure you have adequate vitamin D is very important. At this time of year, most people, if they're not taking vitamin D as a supplement, will have low vitamin D if they live in the Northern Hemisphere. So taking between 2,000 to 10,000 international units a day. 10,000 would only be if you have a deficiency, and then you would take that for a short period of time. Once your levels have come up, you would reduce to like a maintenance dose. NAC, so NAC stands for N-acetylcysteine, and this is the precursor for glutathione. We know from clinical trials that if you have lower levels of glutathione in your lungs, you're more likely to have lung pathologies, in terms of if you are getting sick, you're more likely to get bronchitis or pneumonia if you have low levels of glutathione in your lungs. And people with lung disease do tend to have lower levels. So for example, asthmatics have been shown to often have lower levels of glutathione in the lungs. Apart from this, the NAC also has this ability to kind of liquefy the mucus and help to dissolve biofilm. So often when bacteria or virus infects the respiratory tract, it forms like a biofilm. So the NAC has a beneficial effect on breaking this down as well. So I would highly recommend taking NAC twice a day during this period. Beta-glucans, we've mentioned quite a few times in terms of things like medicinal mushrooms that contain it. Also the the usnea we mentioned earlier also contains it. So also you can take it as a supplement. So you can buy this on its own as a supplement, but of course you can take it in the form of your medicinal mushroom, and also you can take it through your diet. So we'll talk about that. But things like oats contain beta-glucans, for example. Obviously mushrooms, you can eat mushrooms. Fish oil, I have been recommending people in the run-up to this epidemic to take fish oil, because what fish oil does is it puts your body into an anti-inflammatory state, which is what we want your body to be in when it encounters a virus. So as well as it being good for all those kind of chronic health conditions that people have, I mean basically every chronic health condition has some kind of inflammatory nature to it. So taking the fish oil helps with diabetes, it helps with heart disease, helps with a lot of these inflammatory conditions as well. So it's a win-win. Making sure your gut flora is good. So you could do that through a probiotic or a prebiotic. So prebiotics are foods or supplements that feed the microbiome, and probiotics are actually bacteria. So you could have more fermented foods, you could eat things like kimchi, you could take a supplement, of course. A prebiotic food, is like an indigestible starch. So that could be, we mentioned inula earlier, inulin in the herb inula, that would be a prebiotic, or a Jerusalem artichoke has a lot of prebiotics. The good bacteria essentially stimulate your immune system. They increase IgA, which is the first line of defense in your respiratory tract. They also increase natural killer cells, especially in the elderly. So again, when we kind of worry about that elderly group, it really might be a good idea for them to have some extra microbiome support. often in elderly patients, their nutrition isn't always as good. Their appetite goes down as their metabolic rate goes down, and we see that they tend to eat less. So then they're getting less of these prebiotic foods in their diet. Quercetin. So we've mentioned quercetin a few times during this talk because it's in lots of the herbs we've discussed, like it's in Baikal skullcap, it's in nettle, it's in elderflower we mentioned. Many different herbs contain quercetin. It's a very ubiquitously found flavonoid compound. It's got some interesting research coming out of Montreal showing it to be potentially also antiviral, a broad spectrum antiviral, and they're trying to actually get it tested specifically against COVID-19. Regardless of its antiviral properties, it is anti-inflammatory. So you could take a quercetin supplement. I also really like the idea of eating it in your diet. It's very poorly absorbed quercetin, only like 20%, 25% is absorbed. So it does seem to be better absorbed when it's in a food. So even when they mixed quercetin into food, into like a cereal bar, it was better absorbed than taking a pill of it. So it's maybe good to eat a quercetin-rich food. So that would be things like onions. Onions, it seems to be much more bioavailable than apples even. And interestingly, onions have a long history of remedies for lung disease. So it's kind of interesting that it's more bioavailable in onions as well. So definitely you can take a supplement. I personally am eating it in the food and taking a supplement. But you could for sure just have it through the food. Also, nettle tea is a great source of quercetin. We were mentioning that earlier. Vitamin C. So vitamin C is an interesting one because they are currently doing a clinical trial in China, and we don't know the results yet, but they're giving high dose vitamin C in the form of IVs for the treatment of the coronavirus. And I've had anecdotal reports, again, coming out of China, where they've given oral doses of 20 grams, that's a lot of vitamin C, preventatively to family members of someone who's got coronavirus, and then the family members aren't getting it. So it does seem at this point that vitamin C is probably beneficial, right? We know vitamin C has benefit for the immune system generally, and in high doses this possibly has some antiviral properties. Also, it's kind of protecting your lungs, because as we were mentioning with this whole inflammation going on in your lungs with pneumonia, anything that's antioxidant is going to help to calm that down and help with it not going out of control. Also, high dose of vitamin C helps to clear histamine. It's fairly harmless, apart from it can disrupt your digestion. You can have some diarrhea in a high dose. Personally, myself, I am taking vitamin C, 6,000 more or less milligrams a day. And in my office, we actually do intravenous vitamin C. So if I'm feeling run down at all, if I feel like I'm fighting a virus, I just will get a bag of vitamin C in a high dose. These high doses we're talking about in China, even higher actually. And then the next day you feel like you've fought it off. So I think during this period of time, I myself am going to be getting that as like a preventative essentially to any virus that might be going around. So just again to reiterate in terms of the diet. So we've already mentioned beta-glucans in terms of the mushrooms and the oats. I think having like an oatmeal for breakfast at the moment would be a great idea in terms of introducing more beta-glucans. Eating mushrooms several times a week is also a great idea. You can eat them daily, wonderful. Fresh ginger. Fresh ginger has some really great properties. It's very antiviral, and again, people forget about it as a herbal medicine, but it's really a powerful herb, and it has these powerful anti-inflammatory compounds. So again, making some fresh ginger tea or incorporating that into your diet is a really great idea. Again, we've mentioned the garlic, allicin being antimicrobial. You can buy allicin as a pill, but equally you can have raw garlic. So just to end with some general other things that I have been either doing myself or recommending to people. So gargling. The virus does obviously initially adhere to your throat, so it seems to make sense that gargling with even just water, but you could use salt water, you could use some ionic silver, an antimicrobial herb like calendula, sage, myrrh. Fairly regularly, it's probably a good idea, just because if you have got some virus in your throat, you're just trying to kill what's trying to take hold there. Also, you can do nasal inoculation with silver, or salt water irrigation of your nasal passages several times a day. The doctor I work with, Dr. Harv, she, I'm sure won't mind me telling you this, she got MRSA when she was working in a hospital, and that was how she eventually got rid of it, was through nasal inoculation with silver gel. So I think it's not necessarily a bad idea if you want to really try to ward off getting it. Heat. So we know that the bone marrow needs a certain temperature to kind of produce white blood cell count, and in the winter we tend to be more on the cold side, obviously, because the ambient temperature is cold. So keeping warm will help your bone marrow's turnover, and it will help the white blood cell count to increase. Also, possibly a warmer body temperature may make you less hospitable to a viral infection. Also, again, this is purely speculation, possibly sauna, increasing your body temperature significantly. I mean, the reason we have fevers is essentially the body's way of trying to kill viruses, because most viruses are heat sensitive. So increasing your body temperature up is going to make it more uncomfortable for a virus. Again, on a personal note, I have found in the past, if you are feeling under the weather, having a sauna or an infrared sauna, even better, can knock a virus on its head. So I've seen that in my own anecdotal evidence. I haven't seen any clinical trials on it, so it's not something that I'm recommending from a scientific point of view, but I think it kind of makes logical sense, and from personal experience and experience with patients, it does seem to help. So and we know that bone marrow cell production is affected by body temperature or temperature of the long bones. Steam inhalation with oils. So basically, a lot of essential oils are antimicrobial. So if you're doing regular inhalations, the phenolic compounds in the essential oils will be killing those bugs. And basically, every single essential oil you can think of has been tested against microbes. They're basically antimicrobial. Ones I particularly recommend are eucalyptus, thyme, we've already mentioned, thyme essential oil, also peppermint essential oil. These are all great oils that are antimicrobial, and also all those oils I mentioned have like an expectorant action as well. But again, you could be even doing that preventatively, having a steam a couple of times a week, just if a virus is kind of starting to take hold, you're just kind of helping your body to kind of clear it. Sleep. So adequate sleep is very important for a robust immune system, and this has been shown again and again in clinical trials. So one of the most simple things you can do is just get a good night's sleep. I wanted to mention about relaxation. Again, I've mentioned this a couple of times, that I've seen that anxiety and stress is a big part of this this pandemic. So maybe many of us will not get ill, maybe many of us will get a mild illness, but a lot of people are suffering with fairly extreme anxiety at the moment, and all the associated symptoms with that. And at the end of this whole process, they may look back and think, well, what was worse, the actual virus effect on me personally, or the anxiety that I felt during this whole period? And then secondary to that, stress and anxiety is not good for your immune system, right? So I would highly recommend meditating, or potentially taking nervine herbs, and we're not talking about those here because it'd be a whole other talk, but herbs that are relaxing to the nervous system, or even CBD oil or something like that. Anything you can do. Even better, have some fun, right? We know that your cortisol levels can be reduced even more than meditation by having, a night out with friends and laughing. So it seems that humour and just relaxing is really, really good for your immune system and your cortisol levels. So I really would recommend that, giving you a lot of information to protect yourself in terms of your immunity and what to do if you get sick. Obviously protect your loved ones who may be in at-risk categories, or maybe yourself. But I do think we have to try to remain calm and realise that this isn't the end of the world, and that although some people are going to get this illness potentially very badly, the vast majority will not. So my kind of final word to you all is to stay relaxed, and by all means you can reach out to me and ask any questions. I know that people are anxious, and I hope that information that I can give you will be calming and not make it worse. And I really wish that you can all get some good nutrition, some good sleep, some good laughs, some good herbs, and keep the people who are at risk safe. And the likelihood of you're fit and healthy, you're going to be fine, right? So thank you for listening to the bitter end of this very, very long video. And maybe this is the start of me doing this more regularly. I'm sure I'm going to remember lots of things that I've forgotten at the end of this, so I may do some amendments and add a couple of bits at the end. But thank you for watching.